I'd like to start with a quick presentation on why bother with standards at all? Okay, so here's one reason why we possibly should. This guy, some of you may recognize. He's a famous American actor, and he had newborn twins who were in ICU in a hospital, and they were given heparin. And heparin is an anticoagulant, and it's to keep the lines free from clotting when they're giving these premature babies antibiotics and other fluids. The nurse in the middle of the night gave the heparin, but she gave 1,000 times the dose that should have been given. Okay, and you can see the only difference in the doses is the shade of the bottle. So if you're a nurse in ICU in the middle of the night, you're relying on really good eyesight as well as being in a stressful situation to try and give the best care. So that is enough reason, as far as I'm concerned, why we need standards. So he has become an advocate now for patient safety using barcodes on medication. And so the question was asked, well, how did this mistake happen? And these are the main causes that they say that happen. Now, it's all, as they say, it's a no-brainer. I mean, it's fatigue, inattention, memory lapse, and lack of knowledge and failure to communicate. And these are common to everybody that works, whether it's in the healthcare sector or anywhere else. But what I'd like to ask you is, do these items suffer from that? So if you can take away the risk, then you're going to improve patient safety. And it really is as simple as that. And we heard some great presentations, absolutely fantastic presentations this morning. Some of them referenced unit dose medication. So GS1 to date has been really good at getting barcodes on secondary packaging and on pallets through the supply chain. But in order for them to be of benefit, they really need to be in the unit dose. And manufacturers have been resisting that. And they've been resisting it for one pure reason, which is cost. So I think if there are any healthcare professionals here today, which I hope there are, then you really should be lobbying these manufacturers and saying, we need this, we need medication at unit dose level. So what's the business case for barcode scanning? Well, as you can see, you have efficiencies that you can gain. The error rate that you normally have for even a skilled typist is 1 in 300, but the risk from scanning a barcode is much higher than that, so much lower than that, sorry, because the chances of an error are in the millions. So what are the benefits? And I've gone through these benefits, but they're not only patient safety, but they also help the running of the hospital, and they help to reduce costs, which is what we're trying to do. We're all trying to do more with less. So we all want to improve patient safety, but we do realize that there is a finite pot of money in order to do this. So we saw the medication problem, but also there was the PIP implants where these implants were found to be defective and leaking. The problem was that in the supply chain, they didn't know where they were, and that showed a deficiency in the supply chain that could have been resolved using standards, barcode standards. Implants was the same. So I think a lot of healthcare practitioners know that there is a problem there. They're very conscious of it. But I think this slide really sums up what the issue is. So we know there's a problem, but the problem is that we're too busy doing our work, and what we want is a solution. So the solution is there, but we really want help in implementing it. And the fact that GS1 standards offer that solution, but they also offer a network of your peers who are here, some of whom are here today, who can help you, and you can reach out to those people so that you're not alone. And we had our working lunch that some of you are with, and Jackie was there from that. And I think it's very important that you realize that you're not working in isolation, that there are other people that may have done what you want to do. So through GS1, it is possible for you to reach out to other people. These standards have been used in places such as Leeds, where they have been able to show significant reductions and improve patient safety. And again, here's another example. Now, these examples are available through the GS1 website, so I'd encourage you to go to the GS1 healthcare website where you can get examples and other examples. Also, in a bid to try and publicize the fact of the efficiencies and patient safety gains, GS1 commissioned a company called McKinsey to write a report and look at what could happen if you did implement standards. And as you can see, there are lots, both financial and patient safety, that can be accrued by simply implementing standards. And again, this publication is available through the GS1 healthcare website. So why GS1? And it's a very good question, because there are other standards out there. And what I want to ask you is, how standards are the standard in healthcare? So this is what you hear a lot, okay? So a lot of people, if they can't find a standard, they're happy enough to make up their own. What is the problem with that? The problem with that is that, here's an example. The Toblerone box, as you can see there, of medication has a number of barcodes all over it. So if you are a nurse in ICU in the middle of the night, which one of those do you scan that will be accepted in your system, that will check for contraindications and allow you to safely administer that product? Again, with the implant, you have a number of barcodes on it. So we don't have standardization, and as healthcare professionals, we just want one barcode. No disrespect to GS1, we don't really care what that barcode is as long as it's one barcode. But what I found through my work with GS1 is it's the only game in town as regards barcoding. So I think it's what it can help us do then is provide the 5 rights, and we've heard about those today as well. Okay, right, minor haste. So while we're working on that, I'd like to introduce the panel members. Ladies first. So first, a very good friend and colleague of mine, Frédérique Fremont, who is an organizational engineer from the Ballinger Hospital in France. She's currently, as I said, an organizational engineer in a public hospital, working as a manager of the outpatients clinic and medico-technical department. Her previous activities included consulting positions with Ernst & Young and an industry and healthcare sector for providers and pharmaceutical companies. Frédérique has implemented projects based on GS1 standards for a number of years. How many years have you been involved with GS1?
More than 10 years.
More than, and she's only 12 years old, which is amazing.
I love it.
She's a long-time member of GS1 and is the co-chair of traceability and level below each, which is unit dose marking, which we really are pushing to get. And she's also the co-chair of the HPAC, which is the Healthcare Providers Advisory Council. She's a member of the steering committee for GS1 France Healthcare, and she was the first winner of the HPAC Provider Award. So I think we're getting closer to some pictures, Frédérique. So
the power cord wasn't quite going anywhere.
okay, so maybe I should then just I will introduce Eric Van Ark, and it is a privilege. He's a consultant anesthesiologist at Bernhoven Hospital, and he's been involved with the implementation of preoperative screening of patients, patient logistics, and the reorganization of patient scheduling and OR organizations. Besides this, he's an executive director of the medical staff. In this function, he was involved in the complete reorganization of the hospital towards business units. Since 2012, he's the chairman of the OR in a dual management system in which the doctors are the lead. He is a supporter of GS1 standards of healthcare, and it's a privilege to have him here because Eric was a little bit nervous because he actually says himself he's not at the coalface of implementing GS1 standards, but without champions such as Eric, then a project will not go any further. And we heard today at lunch, Jackie was asked, how do you implement a standard? If you don't have an advocate such as Eric, it's not going to happen in a hospital because these guys are vital to do it. And our last speaker will be George Nicholas, who congratulations on your award. And he's head of pharmacy. And he was head of the sterilization unit in Ballinger Hospital. He holds a degree in pharmacy and 2 master's degrees in pharmacokinetics and biopharmacy. Do you ever go out, George? No? Yes. He's involved in the improvement of patient safety and traceability of drugs and medical devices with GS1 standards since 2005. So that's 10 years, George, so he has a lot of experience in this area. He's published more than 20 scientific articles and presented more than 70 posters in scientific congresses. So I really am chuffed that these guys are on the stage today. So I'd like to, our first speaker is Frederic, so I'd like to invite Frederic to come up.